This show is part of OnePlace, a daily network of focused briefings across the stories people follow most.
Welcome to our daily roundup. We have a packed schedule today covering everything from the psychology of mental health to the complex financial realities of modern healthcare and long-term medical care.
Believing in chemical imbalances may keep patients on antidepressants longer.
A husband navigates birthday gift-giving for a wife with dementia.
Doctors help patients connect the dots with wearable health data.
New research links childhood trauma to specific adult sexual preferences.
Political bias strongly influences the impact of general conspiracy thinking.
Real estate investors are buying nursing homes, impacting resident care.
Private doctors now lead medical debt lawsuits over hospital systems.
A mother describes the isolation caused by rising measles outbreaks.
Let's start with antidepressants.
A fascinating study in the Journal of Affective Disorders suggests that how we view depression significantly impacts how long we stay on medication. For decades, pharmaceutical marketing pushed the idea that depression is simply a chemical imbalance, specifically a lack of serotonin. While this was meant to reduce stigma, it has created a situation where many patients view their condition as a permanent biological defect, rather than a reaction to life events. Consequently, those who hold this biological view are much more likely to stay on antidepressants for years, even when their symptoms are mild. In the US, nearly half of all patients on these medications have been taking them for over 5 years. This is despite the fact that modern research has failed to find consistent evidence linking depression to abnormal serotonin levels. The belief itself seems to be a primary driver of long-term use.
It is quite a shift from the original intent of those marketing campaigns. Researchers, like Molly Griffin-Williams and Joanna Moncrief, are finding that this biological perspective makes patients much more hesitant to even attempt tapering off their medication. When you believe your brain is fundamentally broken, the idea of stopping a corrective chemical feels dangerous. This persists even though up to 80% of the population in Western countries still holds on to the chemical imbalance theory. The study highlights a massive gap between current scientific understanding and public perception. While medical guidelines do suggest ongoing treatment for some, experts worry that a huge portion of long-term users might be taking these drugs unnecessarily. By framing mental health through a purely medical lens, we might be inadvertently trapping people in a cycle of lifelong medication that doesn't always align with their actual clinical needs or the latest neurological evidence.
Next, a personal story.
We often talk about the clinical side of dementia, but the emotional toll on partners is immense, especially during milestones like birthdays. One husband recently shared his struggle with whether to buy a gift for his wife, Marcia, who no longer remembers her own birthday or even recognizes him consistently. Dementia has robbed her of the ability to speak or walk, and she can no longer wear the earrings or scarves he used to buy. He noted that since she has no memory of the date, he could technically skip the occasion without her ever knowing. It would be one less stressful responsibility in a life now defined by daily visits, back rubs, and wheelchair walks. However, he realized that the gift isn't just for her. It's a way to maintain a connection to their shared past and to find a fleeting moment of joy in a very sorrowful stage.
His solution was to pivot toward gifts that evoke an immediate sensory reaction rather than something functional or symbolic. Even if Marcia can't say thank you, the act of giving becomes a bridge to the person she used to be. It's a poignant reminder that caregiving isn't just about the physical tasks like feeding or hygiene. It's about preserving the dignity and the history of the relationship. He mentioned how he used to buy her books on history or CDs of Bob Dylan and the Beatles, but now he relies on an Alexa device to play those same songs in her room. The transition from shared intellectual interests to simple sensory comfort is a common path for families dealing with cognitive decline. Ultimately, he chose to keep the tradition alive for himself as much as for her, proving that love persists even when the memory of that love has faded away.
Now, onto wearable technology.
Millions of people are now using smartwatches and rings to track every heartbeat and sleep cycle, creating a $100 billion industry. But for many, this mountain of data is just noise until they talk to a professional. Sophie Krupp from Minneapolis is a great example. She used an Oura ring to track her migraines and eventually found that her symptoms were tied to hormonal cycles and even minor alcohol consumption. However, doctors like Lucy McBride warn that showing up to an appointment with weeks of raw data isn't helpful. The key is to report patterns rather than single data points. A spike in heart rate means very little without the context of what was happening in your life at that moment. Was it a stressful day at work, or were you coming down with a cold? Without that narrative, the numbers don't provide a clear path for medical intervention or lifestyle changes.
Neurologists like Dr. Sarah Benish are now seeing the value in this data because it offers a window into a patient's life outside the clinic. When a patient can show a week of disrupted sleep following a specific trigger, it tells a much more complete story than a single snapshot during an office visit. The American Academy of Neurology has even started providing informal guidance on how to integrate this wearable data into clinical practice. The goal is to move away from obsessive tracking and toward meaningful self-knowledge. If you can connect a behavioral change to a physical outcome, you're much more likely to stick with a health plan. It's about using the technology as a conversation starter with your doctor, rather than a replacement for professional diagnosis. When used correctly, these devices can help bridge the gap between how a patient feels and the physiological evidence that explains why they feel that way.
Next, a study on preferences.
A new study in the journal Behavioral Sciences is looking at the complex links between childhood trauma, attachment styles, and adult sexual preferences, specifically within the BDSM community. Historically, psychology viewed alternative sexualities as inherently problematic, often because early research focused on non-consensual cases. Today, we know that consensual power exchange is practiced by 20 to 30% of the population. This new research found that individuals with a history of childhood sexual abuse or insecure attachment patterns often have specific preferences for submissive or dominant roles. Attachment theory suggests that the care we receive as children creates a mental blueprint for our adult relationships. Securely attached people trust others easily, while those with insecure attachments might seek approval or fear abandonment. The study suggests that for some, these adult sexual roles might be a way to navigate or even reclaim agency over past emotional blueprints in a safe, consensual environment.
It is important to emphasize that these practices are built on the foundation of being safe, sane, and consensual, which distinguishes them entirely from violence. The researchers found that preoccupied individuals, who often fear abandonment, might lean towards certain roles to find the security or control they lacked in early life. By separating atypical sexual interests from mental health disorders, modern science is finally able to look at these behaviors through a more nuanced lens. The study doesn't suggest that trauma is the only path to these preferences, but rather that our early emotional bonds play a significant role in how we express intimacy and power as adults. Understanding these connections helps destigmatize alternative lifestyles while providing insight into how humans process past experiences through their current relationships. It's a major step forward from the skewed clinical perspectives of the past that failed to account for the importance of consent and community safety frameworks.
Now, let's discuss politics.
Research published in Political Psychology is shedding light on why conspiracy theories are so effective at fueling political division. The study found that a person's general tendency toward conspiracy thinking, the belief that secret, sinister forces control the world, is a strong predictor of whether they'll believe a specific rumor. However, there's a catch. This tendency is most powerful when the rumor targets a political rival. We naturally want to protect our own group's reputation while assuming the worst about our opponents. Omer Yair, a researcher at Reichman University, discovered that psychological traits and political loyalties work together in a powerful interaction. It's not just that some people are more prone to conspiracies, it's that their bias acts as a filter, making them eager to accept misinformation that aligns with their partisan goals. This explains why the same person might be highly skeptical of one theory while completely uncritical of another that attacks the opposite side.
This interaction hypothesis helps explain the rapid spread of misinformation in our current climate. When a rumor aligns with a person's bias, their general conspiratorial mindset kicks into high gear, overriding their critical thinking skills. The study suggests that partisan identity acts as a catalyst for these beliefs. It's a two-step process. First, you have the underlying psychological predisposition to see hidden hands at work. And second, you have the tribal urge to see your enemies fail. When these two factors meet, the result is a deeply held belief in partisan rumors that can be nearly impossible to debunk with facts alone. Understanding this mechanism is crucial for anyone trying to combat the spread of false information. It shows that we aren't just dealing with a lack of information, but with a complex psychological interplay that makes certain lies feel like obvious truths to those who are already predisposed to believe them.
Moving to nursing homes.
A troubling trend is emerging in long-term care, where real estate investment trusts, or REITs, are buying up the buildings that house nursing homes. While these trusts claim to be just landlords, a KFF Health News investigation reveals they often have significant influence over operations. Take the case of Pearline Darby, who died from severe infections and bed sores in a facility owned by Care Trust REIT. While the facility was running a deficit and struggling with staffing, it was still paying over $1 million in rent to the REIT. Internal records show that Care Trust wasn't just collecting checks, they were tracking financial plans down to the penny spent on food and nursing. and even requiring an 80% occupancy rate. This creates a situation where the pressure to pay rent can overshadow the need to provide quality care, leading to threadbare staffing and safety violations that directly impact the health of vulnerable residents.
The legal structure of these deals often shields the real estate owners from liability. Federal rules prevent REITs from actually running the facilities, so when things go wrong, they can claim they are merely property owners, not operators. However, the investigation found that these landlords often select the management companies and keep them in place even when they are aware of repeated safety failures. This disconnect between financial control and clinical responsibility is a growing concern for patient advocates. In many cases, the money that should be going toward patient care is being diverted to satisfy lease agreements. Families are often unaware that the building's owner is exerting such granular control over the budget. As more medical facilities are bought by investors, the risk is that the bottom line will continue to take precedence over the well-being of the people living inside, leading to more tragic outcomes like the one Pearline Darby's family experienced.
Next, medical debt lawsuits.
In Connecticut, there has been a major shift in who is taking patients to court over medical bills. 5 years ago, hospital systems were responsible for 3/4 of health-related collection cases. Today, that has flipped. Now, private doctors, dentists, and ambulance companies account for over 80% of these lawsuits. While many large hospitals stopped suing patients due to public backlash and stricter regulations for nonprofits, smaller private practices are stepping into the void. These lawsuits often involve relatively small amounts, sometimes less than $3,000, but the consequences for patients are devastating. We're talking about garnished wages, liens on homes, and being blacklisted from receiving further care. One nurse, Allie Cass-Wilson, found herself sued over a debt she didn't even know she had, only to be told her doctor would no longer see her. This shift into a less regulated realm means patients have fewer protections against aggressive collection tactics.
The impact of these lawsuits goes far beyond the financial cost. They sap trust in the medical profession and prevent people from seeking the care they need. When a patient is blacklisted by their primary provider over a debt, their continuity of care is completely interrupted. Unlike nonprofit hospitals, private medical groups aren't required to offer financial aid to low-income patients or follow federal limits on collection activities. This leaves struggling families in a precarious position, often facing hundreds of dollars in added interest and court fees on top of their original bill. The investigation by the Connecticut Mirror and KFF Health News highlights how medical debt continues to burden an estimated 100 million people across the country. As the source of these lawsuits shifts from large institutions to individual providers, the legal landscape becomes much harder for the average person to navigate, often resulting in ruinous financial outcomes for those who are already vulnerable.
Finally, the measles threat.
For families with immunocompromised children, the recent resurgence of measles in 32 states is nothing short of a nightmare. One mother shared her experience caring for her teenage son, who has an ultra-rare genetic disorder called OCNDS. His treatment involves medications that severely suppress his immune system, making a disease like measles potentially catastrophic. Her family has had to completely restructure their lives, with her husband leaving the workforce to homeschool their son, and the entire family avoiding public spaces. Even simple trips to the library or a farm now require extreme planning, masking, and social distancing. She expressed frustration with the idea that the threat of measles is overblown. While medical innovation is incredible, it cannot replace the basic safety provided by high vaccination rates and clean air. For her son, the lack of community immunity means he is effectively trapped in his own home to stay alive.
This story highlights the human cost of declining vaccination rates. Measles is primarily spreading through school-aged children and appearing in common communal places, making the world feel increasingly small for those who are vulnerable. The mother, who is actually a believer in medical tech and works with rare disease foundations, points out the irony of focusing on high-tech innovation while failing at the basics of public health. Skeptics often tell her that her fears are exaggerated because they trust modern medicine to fix any problem. But for an immunocompromised child, there is no easy fix for a measles infection. The outbreak has compounded her family's isolation and serves as a stark reminder that our individual health choices have profound consequences for the most fragile members of our community. It's a call for a renewed commitment to the fundamental principles of health and safety that protect everyone, not just those with robust immune systems.
That's our roundup for today. Thank you for joining us for these important stories. We'll be back tomorrow with more updates on the issues that matter most to you.